stroke.com. And Dr. Michael Sauter is in the studio with us this morning as we talk about, well, it's a favorite topic simply because May is Stroke Awareness Month. It's not a favorite thing that folks would have to deal with, but thankfully we have guys like him and folks like those at the Indiana Regional Medical Center to help us to deal with strokes. And our conversation this morning brought to you by Marcus & Mack, voted Best Personal Injury Law Firm, the Best of Indiana County Contest. Marcus & Mack, a law firm representing injured people. IRMC has a special designation, doesn't it, Doc, as a stroke care center?
Yes, for the last 5 years, we have been what's called a primary stroke center, designated by the American Heart Association, American Stroke Association, in terms of our level of expertise and competency and capability in regards to managing acute strokes.
Yeah, and so let's talk about stroke. We talk about innovations and advancements in care and treatment and diagnosis of all kinds of diseases. It seems like in the last year or so, in terms of dealing with stroke, we've really made some great advances, haven't we? Some great strides.
We have. We've made local advances and we've made national advances. In regards to the local advances, we have a great team from the EMS group, the Citizens Ambulance, to the ER physicians and nurses at Indiana Hospital, to the stroke team headed by Sarah George and myself, so that we can provide state-of-the-art care for acute ischemic stroke, either in the form of tenecteplase, which is a clot-busting drug that can be given to patients who present to the hospital within 3 hours of their symptoms, or in a different range from 3 to 4.5 hours range. The idea behind this medicine, this clot-busting drug, is to try to break apart the clot and allow reperfusion or resumption of blood flow to the injured area of the brain so that that function can be regained. Now, that has a good track record, but it doesn't have a great track record. Mm-hmm. There is a newer technology called EVT, or endovascular therapy, in which they thread a small catheter up right into the brain and snare the clot that is blocking blood flow to the brain. And that'll have a higher efficacy rate or success rate in terms of reperfusing an injured area.
When you hear of these new advancements of great technological or just simple medical knowledge that is helping to deal with strokes and getting people to the other side of their stroke as quickly as possible, I'm sure for families that have been through the stroke experience, it's very exciting. For you who deal with it all the time, it must really, really excite you.
It does. It does, because it signifies that the team that we put together has succeeded in organizing, diagnosing, and then intervening in the necessary ways to help that person reclaim their level of function that they were accustomed to before this catastrophe developed.
Yeah. So let's talk a little bit more about perfusion and perfusion studies and how they go into helping a patient. You mentioned the time frame for ischemic stroke.
The time frame is so important because just like everybody's natural inclination is to deny that something really bad is happening, what we want to say is don't deny. Come on in. If we don't think that there is something severe going on, we'll just send you home.
Yeah.
If indeed we think that something severe has developed and is going to progress, we'll take care of you here, and if necessary, we'll get you into a tertiary care center where they can do the endovascular therapy as well. So the key here is showing up. Never deny, so that the onus is on us as care providers to make that evaluation on your behalf, on the patient's behalf, to say, hey, if this is something real, we'll help you deal with it.
Yeah. And we have in the past dealt with the idea of the different types of strokes that are out there. But perhaps now is a good time to explain. There are two primary types of strokes that we talk about.
Exactly right. The most common type is a blood clot stroke, where the blood vessel itself it becomes blocked, either because of intrinsic narrowing of the blood vessel over the course of one's adulthood, and that's called a thrombotic ischemic stroke. The other branch of that is called an embolic ischemic stroke, where you have a blood clot from the carotid artery or from a valve in the heart or from the abdominal vasculature that goes up to the heart and then gets projected to the brain and blocks a vessel. Those are two types called ischemic strokes. They occur about 85% of cases. Mm-hmm. There's a different type called a hemorrhagic stroke, in which the blood vessel bursts inside the brain, and you have bleeding either into the brain tissue or around the coating of the brain called the meninges. Mm-hmm. That can be more catastrophic and have a higher morbidity and mortality with it. And so again, it points to the urgency of getting in to the ER and getting the imaging studies done to help make that distinction between an ischemic stroke and a hemorrhagic stroke.
Something new on the horizon that I'm sure is very, very helpful as well is rapid AI technology in helping with the diagnosis.
Yes, the rapid AI technology is really a game changer for us locally and for the country, because what it allows us to do is identify whether a large vessel in the brain has become occluded or blocked, and what is the territory that's under threat for irreversible damage. So the AI CT readings can help us to identify whether there is still viable tissue that can be salvaged and saved, and so the function can be reestablished in that patient or not. And so it allows us to gear up our resources both locally and regionally so that we can identify recoverable brain tissue. Really dynamic, because this hasn't been done in the United States before. And we are part of it. We are not the a progenitor of it or the promoter, but we are a participant in this new technology, new information technology to help bring about better recovery from strokes.
We're talking to Dr. Michael Sauter of the Indiana Regional Medical Center about stroke during Stroke Awareness Month. Of course, this information is coming to folks who probably are not feeling the effects of a stroke right now. And so when they hear what we're talking about, they might say, okay, if that ever happens, I'll try to remember that. We need to be on the lookout for signs of a stroke, particularly when we get to a certain age. But especially if we also have certain lifestyle and other problems, other medical problems that could be exacerbated and lead to stroke.
Sure. I think one thing that everybody must come to understand is age itself is a risk factor for stroke, just as age itself is a risk factor for heart attack. And by that I mean that as we go beyond age 60, all of us carry a higher risk of blood vessel problems, circulation problems. And so what it tells you is that if you're growing into that older population, and especially if you carry vascular risk factors such as prior history of heart disease or diabetes, that you must really respond to any changes in your baseline level of function and either call or show up in the ER so that we can help you sort out those dilemmas.
There has always been an acronym, and it's actually an acronym that has expanded. It used to be just, I think, FACE. Mm-hmm. That acronym helps us to recognize the signs of a stroke.
Right now it's called BFAST, and what it's really telling you is you look for your symptoms of speech, touch, motor function, vision, and if you have any changes in those domains, you quickly respond by either, again, presenting to the emergency room preferably, or contacting a care provider and running it past them so that they can give guidance in an emergent way.
Just as you at IRMC follow the teamwork approach in dealing with strokes and helping folks who have had strokes, we within our own families and list of acquaintances have to be aware of the signs of stroke too, because we might come home and find somebody sitting in a chair and something obviously wrong and we don't know what it is. So those signs are really important for us to be able to recognize.
Absolutely. And what we really want to make sure is that if you have a loved one who suddenly has a change in their communication ability or change in their speech ability or one-sided weakness, then that generally suggests that blood flow to the brain has been compromised in an acute way, in a sudden way, and needs to be addressed, because we can do many things to help restore the flow to the brain and thereby restore the function to the person. And that's really what it's all about, trying to intervene as quickly as we can.
Yeah. The distance from IRMC obviously will help people to understand how quickly to get somebody to the hospital. But generally, that call to 911 is the most important call you can make.
That's the essential one. To again, go beyond the denial that all of us face when we say, oh, maybe something's wrong, but I'll just rest on it. I'll just sleep on it. And then tomorrow, if it's there, then I'll call somebody. We don't want you to do that. We want you to contact us through 911 and respond as quickly as possible to allow us to respond as appropriately as possible.
And I want to bring up something else that we've talked about in the past, and that's the concept of a mini stroke. Somebody suffering from what used to be called a mini stroke and saying, it's just something I'll get over, and I can put that off. I don't need to seek treatment for something like that. That's just a little thing. Mini stroke, major stroke, not really a term that we should be thinking of.
Exactly right. If we could get rid of that phrase, I would be the happiest man in town. Mini stroke has so many different meanings to so many different people. What you really want to think of is a transient event where deficits come and then they resolve within an hour or within a couple hours. That's a transient stroke called a TIA. What you also have is a minor stroke in which a relatively small volume of the brain is damaged. What you also have is a major stroke. So you have a minor stroke, a major stroke, and a TIA, which is a transient stroke. Now the key is that you may have more deficits with a major stroke, but they all suggest that you need immediate attention, because the risk of another event is about 5% per year. So even if you've done great and recovered from that first event, if you have to pay heed to the fact that you're now carrying a risk of about 5% per year of another event happening.
Next week at the IRMC cafeteria, Wednesday at 6 p.m., is an event called Head to the Doctor, Headache, Migraine, and Stroke Seminar.
Abby Kaler is one of our nurse practitioners, and she'll be giving that talk to the community at large. And she's a very, very bright person and a very eloquent individual, and we'll be able to explain to you different aspects of migraine headaches, different aspects of strokes, and how they can tie together, because as we all know, we're all familiar with migraines, but not many of us are familiar with the fact that migraine patients have a higher risk of stroke. So there's a comorbidity there that we need to identify and see just how significant is that migraine patient's risk of developing a stroke as well.
Head to the Doctor, Wednesday, May 15th, 6 p.m., IRMC cafeteria. It's a free event for anybody. You can go to irmc.org/2024 to sign up, or call 724-357-7188. Dr. Michael Sauter, we do this every May, but we ought not to just limit it to May, because it's an issue for the entire year, so we ought to talk about it more, shouldn't we?
Absolutely, and it's a great idea to discuss it, because we all discuss heart disease and heart attack, and stroke and brain attack are very similar conditions, very similar risk factors, and the inadequacy of treatment can leave us behind the eight ball for the rest of our lives if we don't respond quickly.
Stroke is the next door neighbor of a heart attack. Dr. Michael Sauter, thank you. We appreciate it.
My pleasure. Thank you so much.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.